Namaste and warm welcome to another episode of Mouthful of Health. I am Dr. Tejo Krishna Pami, a pediatric and preventive dentist with nearly 2 decades of experience in this field, currently on a mission to help 1 million people in the next 2 years to attain a state of oral health that can offer them decay-free status. Today I'm going to talk importance of preventive education in your practice. Today I'm going to present you a case which shows a typical pattern of failure to implement prevention and oral hygiene practices at home and its consequences. Any child below 6 years or having primary dentition and suffering with dental decay is categorized as early childhood caries. And it is a very serious condition affecting a significant portion of children all over the world, irrespective of the race, class, and society. And if preventive procedures are early implemented and parent is well motivated, he can prevent its manifestation to a significant effect and thereby reducing burden of care. It has been a very long time recognized that dental decay or this early childhood caries shows features of contagiousness. That is, if one sibling is affected, the next sibling runs a 95% risk of acquiring this and suffering the same way. That means if first child is affected, we should do all our best efforts to see that the next child doesn't get infected with this, and this all can be done by simple measures. This case which I'm presenting you, that is a 4-year-old boy who reported to me in 2016 with early childhood caries and required a full mouth rehabilitation. And since he was pre-cooperative in behavior scale, and therefore we had to use oral sedation, and with the parent assisted physical restraint, we all did a full mouth rehab, and it was a very tiring job. Following which we had prudently informed them, because it's our protocol that they should report to us in recall visits. This is one more place where it's very important to understand why recall visits are so important. See, in recall visits, apart from the dental examination, we regularly reinforce the parent need to implement oral hygiene practices and improve over it in regular intervals, which motivates them to continue these practices. When a long-term absence to or report for recall visits, they forget the importance of it, and this case shows a similar pattern. That is, today in 2023, they report with the next child, that is almost with the 8 years gap. The next child is a girl child who is about 4 years old. And if you see this case, it's so surprising that she has got all the features. The decay pattern is almost a mirror image, which is so unfortunate that this child will have to undergo a full mouth rehab. Apart from the sufferings and the pain intolerance the child has to undergo, it is also a very huge burden of care. Therefore, if the parent following this treatment is motivated to carry just 2 important features, that is, every day brush twice, that is particularly night time, and it's very important that the parent assist the child to brush up to age 8 years with a pea-sized fluoridated toothpaste, that is 1000 ppm of fluoride, and avoids high frequency intake of sugar-based products, then he is more likely to shift from this high-risk situation to a moderate to a low risk in time. But this requires a professional guidance for which they have to report for recall visits. And therefore, I'd like to conclude by saying 2 important statements. 1, dental neglect is more contagious, and it's proven by this case. and nothing is more expensive than missed opportunity. because if the simple home care instructions are well implemented at home and regularly motivated by you in the recall visits, you can guide the parent child team in a path of recovery and be in a disease free status for a very, very long time. Thank you for your patient listening. See you then later.